This presentation is for educational purposes only and should not be used to diagnose or treat any medical condition. Please speak with your healthcare provider for personalized guidance.
Hello everyone, and welcome to the very first video in this patient education series, an initiative of the family practice of Dr. Ralph Aziz. In these videos, we will be examining common health issues affecting patients, especially within the family practice setting. I am Dr. Jill, and I have the pleasure to be presenting this and other videos alongside other presenters. In this collaborative effort, we all hope that the information serves you well and will stand distinctly apart from other sources of medical information. The idea is to provide more patient-centered info so as to better align the goals and perspectives of both healthcare provider and patient. Before we begin, I'd like to emphasize that this video is for educational purposes only and does not replace medical advice. You should always consult your doctor before making health decisions. So let's kick things off with a big topic that I am sure hits home for just about everyone, and that is stress. What is stress? Stress affects everyone, really. Some stress can be caused by good things in your life, such as an interesting project, a new baby, or an upcoming vacation. Other times, stress is caused by difficult situations, such as losing your job or getting divorced. No matter what causes it, too much stress can wear you down. This makes you more likely to get sick and feel irritable or depressed. You may develop emotional symptoms or unexplained physical symptoms that don't seem to go away, such as anxiety, back pain, constipation or diarrhea, depression, fatigue, headaches, high blood pressure, trouble falling asleep or staying asleep, shortness of breath, stiff neck, upset stomach, weight gain or loss, among other symptoms. As a family doctor, I sometimes see patients whose physical symptoms are actually caused by stress. When I suspect that this is the case, I carefully review the patient's medical history and perform a physical exam. I want to be sure that I rule out any other causes for the symptoms. In some cases, I may do the following: order lab tests or order imaging tests. For example, an X-ray, an ultrasound, or an MRI scan. I may even consult with a specialist when appropriate. In addition to these steps, I try to understand what is going on in the patient's life. It's helpful to ask whether the patient is dealing with challenges such as work pressures, relationship issues, teenage children, aging parents, or a loved one's illness. This is a very typical issue faced by family physicians. So let's consider a real-life example. A few months ago, a patient who we will refer to by the fictitious name Jane made an appointment because she had foot pain that wouldn't go away. Jane is a 34-year-old woman who is otherwise healthy. She had previously seen a podiatrist, but he wasn't able to make a clear diagnosis. Jane's X-rays and MRI scan were normal. They didn't show anything that would cause her foot pain. During Jane's visit with me, I asked about her symptoms and activity. She said that she couldn't remember doing anything to injure her feet. Next, I reviewed her medical history and did an exam. The exam didn't find any problems with Jane's nerves, spinal cord, or brain function that would cause her foot pain. I noticed that Jane said her pain moved from one foot to the other. Sometimes she felt pain on the bottom of her foot. Other times the pain was on top. I asked Jane some questions about what was going on in her life. Her answers made it clear that she was under a lot of work-related stress. She said her boss was difficult to work for and her husband's job situation was unstable. She was burned out by Friday and barely felt better by Sunday morning. On Sunday evening, thinking about returning to work made her feel anxious. Jane was also unhappy that she didn't have more time to spend with her young daughter. After listening closely as Jane described her work-related stress, I told her that I was sorry she was in a difficult situation. I explained that her foot pain might be her body's way of letting her know that she wasn't coping with stress effectively. She agreed that she needed help managing her stress. I suggested some simple things that she could try. Schedule time for a small amount of exercise at least 3 times per week. Spend 5 to 10 minutes per day writing about her feelings. Focus on square breathing at least twice a day. If you are wondering what that is, square breathing is breathing in slowly for a count of 4, holding your breath for 3 counts, and then breathing out slowly for 5 counts. It's a helpful form of relaxation. When Jane came back for a follow-up visit 2 weeks later, she was doing a little better. She was less focused on her feet and felt minimal pain. She told me that she had tried the stress management methods I recommended, including square breathing. She was journaling daily and trying to find more opportunities to be physically active. Jane also reported that she had an interview for a new job scheduled. Overall, she felt less overwhelmed and more hopeful. So, what does all that mean to you? I suggest that if you're feeling overwhelmed by stress, talk to your family doctor. Don't be embarrassed about how you're feeling. Tell your doctor about all of your physical and emotional symptoms. He or she can recommend stress management methods, support groups, counseling, or medicine to help you feel better. Another important thing, don't assume your symptoms are stress-related. There are many medical conditions that may be mimicked by stress. So it's important to see a trained and experienced physician to be evaluated. There is no test for stress. Even long-practice doctors are very careful about diagnosing it until harmful illnesses are ruled out. Self-diagnosis is the greatest harm you can do to yourself. And with that, we've arrived at the end of this discourse. I genuinely hope that this short presentation has been helpful to you. Of course, there's a whole lot more to this topic, but a healthy doctor-patient interaction will best explore this in detail. Well, on behalf of Dr. Aziz, I want to thank you for your attention. Stay tuned to this channel. Exciting things are on the horizon. Remember, your health, our priority.
Thank you, Dr. Jill, for that wonderful presentation. Ladies and gents, we have just concluded the first installment in what we hope will be a huge and hugely successful and influential library of patient education material. We've started by looking at stress. Expect more engaging topics like menopause, low testosterone, dementia, caregiver burnout, and much more. If you're ready to take the next step in your health journey, call us at 868-6640531 to book your appointment. You can also connect and book with us online at www.dralphaziz.com or even email us for appointments. Also follow us on Instagram for updates and health tips. Your care starts with a conversation. We're here when you're ready. Ladies and gentlemen, my name is Sean. Thanks for watching and stay tuned for more. Of course, like, comment, and subscribe. Your feedback will influence the nature of upcoming topics. Until then, bye for now.